Over 40% of adults over 65 take at least one anticholinergic drug. Most do not know what that word means. Many of these drugs are over-the-counter allergy pills, sleep aids, and bladder medications. Benadryl, Tylenol PM, doxylamine, oxybutynin. A 2019 study in JAMA Internal Medicine followed 284,000 adults and found that regular anticholinergic use increased the risk of dementia by 50%. Not 5%, not 10, 50. Your doctor checks your blood pressure and your blood sugar, but nobody checks the anticholinergic load on your brain. These pills are blocking a chemical your memory depends on, and they are available without a prescription at every pharmacy in America. I'm Dr. Garrett Thornton, 34 years in internal medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. It is allergy season. Your nose is running. Your eyes itch. You reach into the medicine cabinet and grab the pink Benadryl tablet you have been taking for 20 years. 2 pills and you are fine in 30 minutes. Or maybe it is nighttime and you cannot sleep. You take a Tylenol PM, same active ingredient as Benadryl, just packaged with acetaminophen. Or maybe your bladder has been overactive and your doctor prescribed oxybutynin to calm it down. You take it every day. You feel less urgency. Problem solved. Except each of these medications is doing something else inside your brain that you cannot feel. Something that builds up over months and years. The myth is that over-the-counter medications are safe for long-term use because they do not require a prescription. That is not how drug safety works. Over-the-counter status means the drug is safe for short-term, occasional use in the general population. It says nothing about what happens when a 75-year-old takes it every day for years. And anticholinergic drugs are particularly dangerous after 65 because of how the aging brain changes. Here is what anticholinergic means in simple terms. Your brain uses a chemical messenger called acetylcholine. Think of acetylcholine as the telephone system in your brain. It carries signals between brain cells, especially in the areas responsible for memory, attention, and learning. Anticholinergic drugs block acetylcholine. They hang up the phone. In a 30-year-old brain, there are enough phone lines that blocking a few does not cause problems. The system compensates. But after 65, your brain has already lost phone lines naturally. Acetylcholine production has decreased. The remaining lines are working harder. When you take an anticholinergic drug, you are cutting the phone lines in a system that is already running on reduced capacity. The result? Confusion, foggy thinking, slower recall, difficulty concentrating. These symptoms are often blamed on aging or early dementia, but they may be drug-induced. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. Let me tell you about Evelyn. Evelyn was 76 years old, retired nurse from Portland, Maine. Evelyn took Benadryl every night for 8 years as a sleep aid. She also took oxybutynin daily for an overactive bladder. Her daughter noticed that Evelyn was getting confused, forgetting appointments, losing track of conversations, repeating questions she had asked 10 minutes earlier. The daughter suspected Alzheimer's. A neurologist ran the standard screening. Evelyn scored 23 out of 30 on the MoCA test, mild cognitive impairment range. The neurologist was about to start the Alzheimer workup when he looked at Evelyn's medication list. 2 anticholinergic drugs taken daily. He asked Evelyn to stop both under supervision and switch to non-anticholinergic alternatives. He told the daughter to give it 8 weeks before pursuing an Alzheimer diagnosis. At 8 weeks, Evelyn retook the MoCA. She scored 27, nearly normal. Her confusion had lifted like fog burning off in the morning. It was never Alzheimer. It was Benadryl and oxybutynin. Here is your first test. Go to your medicine cabinet right now and check for these 4 drug names. Diphenhydramine, which is the ingredient in Benadryl, Tylenol PM, ZQuil, and most store-brand sleep aids. Doxylamine, the ingredient in Unisom sleep tabs and NyQuil. Oxybutynin, a prescription bladder medication also known as ditropan, and chlorpheniramine, found in many cold and allergy formulas. If you find any of these and you take them more than twice a week, you have a significant anticholinergic load on your brain. Here is your second test. Count your total anticholinergic burden. Many common medications have anticholinergic effects that people do not realize. Beyond the 4 above, check for certain antidepressants like amitriptyline and paroxetine, the muscle relaxant cyclobenzaprine, the heartburn drug ranitidine, and the anti-nausea drug meclizine. If you take 2 or more drugs from this list, your anticholinergic burden is compounding. Each additional anticholinergic drug multiplies the risk. Ask your pharmacist to calculate your total anticholinergic burden score at your next refill. Most pharmacies can do this in 5 minutes. Things that increase anticholinergic risk after 65. First, combining multiple anticholinergic drugs without realizing it. A Benadryl for allergies plus oxybutynin for bladder plus amitriptyline for nerve pain creates a triple anticholinergic hit. Doctors prescribe each one separately. Nobody calculates the total. Second, using Benadryl or Tylenol PM as a nightly sleep aid. These drugs impair sleep quality even while making you drowsy. They suppress REM sleep, which is the sleep phase your brain needs for memory consolidation. Third, dehydration plus anticholinergics. Dehydration concentrates the drug in your bloodstream. The brain effects become stronger. Fourth, kidney decline. If your GFR is below 60, these drugs clear from your body more slowly. A single dose lasts longer and hits harder. Here is what you can use instead. First, for allergies, switch to cetirizine or loratadine. These are second-generation antihistamines that do not cross the blood-brain barrier significantly. They treat allergies without blocking acetylcholine in your brain. Available at any pharmacy for about $8 a month. Second, for sleep, try magnesium glycinate 200 milligrams 1 hour before bed. Magnesium calms the nervous system without blocking brain chemicals. It costs about $10 for a month's supply. If you need more help, ask your doctor about melatonin at the lowest effective dose, usually 0.5 to 1 milligram. Third, for overactive bladder, ask your doctor about mirabegron, sold as Mirbetriq. It treats bladder urgency through a completely different mechanism that does not block acetylcholine. Fourth, a nasal saline rinse for congestion. A neti pot or saline spray clears nasal congestion without any medication at all. Available for about $5. This is the Thornton anticholinergic protocol. Step 1. Check every medication in your cabinet, prescription and over-the-counter, against the anticholinergic drug list. Write down every one you find. Step 2. Bring that list to your doctor and ask this question. Is there a non-anticholinergic alternative for each of these? Never stop a prescription medication on your own. But the conversation has to happen. Step 3. Replace Benadryl tonight with cetirizine for allergies or magnesium glycinate for sleep. This single switch removes one of the most common anticholinergic exposures in seniors immediately. Evelyn never took Benadryl again. Her doctor switched her bladder medication to mirabegron. She started using cetirizine for allergies and magnesium for sleep. At her 6-month follow-up, her MOCA score was 28. Her daughter said the difference was like someone turned the lights back on. Evelyn said she lost 8 years of mental clarity to 2 pills she could have replaced at any time. Nobody told her. Write your age below and tell me, how many of these pills are in your medicine cabinet right now? I read every comment. Here are your 5 takeaways. 1. Anticholinergic drugs increase dementia risk by 50% with regular use. 2. Benadryl, Tylenol PM, oxybutynin, and doxylamine are the most common offenders. 3. Switch allergy pills to cetirizine or loratadine. 4. Switch sleep aids to magnesium glycinate. 5. Ask your pharmacist to calculate your anticholinergic burden score. I made this channel for one reason. The information your doctor knows but does not have 12 minutes to explain. I don't sell supplements. I don't have a clinic. I profit from you not needing me. If this helps one person check their medicine cabinet tonight, it was worth making. I'll see you in the next one.